I'm Dr. Claudia Johnson. We're here at Claude Mandel Medical Center, which is a medical center that I named after my father more than 25 years ago. We're standing in the community to keep everyone healthy, and that's the main thing we try to do. We practice a lot of preventive medicine here, but then we also take care of things when they don't go so well. My practice is in gastroenterology, which is diseases of the stomach, liver, and colon, and in internal medicine. And because of the gastroenterology, I had a particular interest in nutrition and how the body processes food and how we can have food help us instead of hurt us. One of the things that we treat is irritable bowel disease. That's quite common, and there are many medications on the market today to give relief. People may have bloating, and they may have constipation, and some have diarrhea. Some have both of them alternating back and forth. The most common probably is the constipation dominant type of irritable bowel. What exactly is irritable bowel disease? You may ask yourself. Well, we all have fibers, nerve fibers in our gut that let us know when there's pain and when there's distension. What we feel, when we feel pain due to reaction to distension, and that distension can be just from air. So a person with irritable bowel is more sensitive to that type of discomfort than an ordinary person would be to the same amount of gas in the bowel. They may not even feel it, but in the irritable bowel patient, it causes a lot of discomfort. And before we were able, years and years ago, before people knew much about irritable bowel, a lot of these patients actually ended up in surgery, having surgery for a condition that needed to be treated with medications or even with increasing fiber in the diet. For losing weight, you have to think of the process involving your entire body and your entire mind. There is no such thing as losing weight and keeping it off and keeping healthy without combining all the things that impact your weight. One is exercise. You have to get up and move. It's as simple as that. The movement that you do in your normal daily life isn't always enough. I've had mail carriers tell me, oh, I'm walking all day long. But your body is used to walking all day long, then that's not going to really help at all. So the other component is what you eat. You know, you are what you eat. And today there are so many things that you can do and so much variety until everyone can find some food that is good and lower in calories or prepared in a way that is not as fattening, and they can do well. We have more options than we have ever had with foods and with juices that are already diluted and waters that are flavored. If you don't like to drink a lot of water, and which you should in any diet, and just for health in general. And the third component is your mind. You've got to think positive. You've got to think in terms of what I like to say, expectation. You have to expect that you can win and expect that you can do well. And then you win. If you think negative, you won't lose the weight. You know, I'm having a hard time doing this. It's impossible. Oh, everybody in my family's that way. I was born that way. Well, then you don't expect much. So you set yourself up for failure. So we do a lot to encourage you and to see what ticks you off, what makes you eat. If you're getting stressed out, don't reach for that bag of candy. I had a patient recently that loves gummy bears. So she'll go through literally pounds of gummy bears if she's having a bad day. And she says, oh, there are only a few calories in a gummy bear. But I said, well, if you ate a pound of them, you had a pound worth of calories at least. So it's a mind-body thing. We have to movement, what we put in the body, and what we think and how we think and what our relationship is with food. What does it mean to you? How important is it? So those are all the things that we consider with all of our programs. Now, at the medical center, we have a program called Perfect Balance Nutrition Programs. It's not just at this center. We now have 5 locations for Perfect Balance. Some of the locations are the ones where we actually do procedures for weight loss. One of the newest procedures that I have fun doing and have fun watching people lose weight after I've done it is the gastric balloon. It's an intragastric balloon that's put in during an endoscopic procedure. The procedure that assists us is the gastroscopy, and that's where a tube is inserted in the mouth, goes down the throat, and we look in the stomach. Now, you are asleep during this procedure. Conscious sedation. It's mild. It's very mild, but it's enough that you don't care what we're doing. And the tube goes in, and a balloon goes in that's rolled up in a catheter. It goes down alongside the gastroscope, and then we are able to actually inject water in that balloon that's deflated when it's first inserted in your stomach. We inject water until it's about the size of a grapefruit, and that takes up room in your stomach. You simply don't have room to put all the food. That stays in 6 months. During those 6 months, the most important things are happening in your life. You're changing, and you're allowing us to help you change, and you're changing in a way that's going to be good for you, not for anybody else. We'll tell you foods to eat based on the types of foods that you like to eat. And of course, the ones that are medically safe for you, that you're not allergic to or that don't make you feel sick every time you eat them. All this happens. We're teaching you how to deal with your stress. And then we're also helping you to exercise. We have personal trainers with our program. They come to you or make it very convenient for you. We've even had them Skype with some people to help them do some kind of FaceTime. So there's all sorts of methods if you're very busy and you cannot get to all these different places, and I can't get to the health club, I can't do this, I don't have this, I don't have equipment. We bring enough equipment to you to use during your session. So we just like to say that we keep weight loss personal and convenient. Yeah, I can be reached now in social media. Social media, really my biggest image there is with the diet and nutrition program. But since it is medically supervised, every aspect of it, and since we have the nutritionist and the psychologist as well as the personal trainer, that's a good place to start. So I have a Twitter account, Perfect Balance Nutrition Program. So we have a Twitter account. We have Facebook. I'm also on LinkedIn.